Thank you all for taking the time to watch this channel, which we created to share the most accurate information about reproductive and sexual health and to raise awareness for a healthier lifestyle. As you know, we frequently talk about vaginal laxity. We also address topics such as genital aesthetic repairs, labiaplasty, perineoplasty, and vaginoplasty. But today, let's examine the complete opposite. What happens if the vagina becomes narrowed, shortened, or thinned? How does this affect a woman's life? And how does it impact the man who shares his sexual life with her? The vagina has a structure. It's capable of stretching and expanding like an accordion. It can easily accommodate a 15 to 20 centimeter penis, and, during childbirth, allows for the delivery of a baby with a diameter of 10 centimeters. After delivery, thanks to hormonal effects, it can return to its original state within approximately 6 to 7 weeks. This is the desired natural formation. However, just as there are conditions that disrupt this formation and lead to vaginal laxity, there are also negative conditions that completely eliminate its flexibility, expansion, and elasticity. Today, we will talk about those. Why does the vagina become narrower and lose its elasticity? How does this condition manifest in a woman's life? The vagina is typically an organ about 8 to 10 centimeters long and 4 to 5 centimeters wide. During sexual intercourse and childbirth, due to hormonal effects, the ligaments relax and can move upward toward the abdominal cavity, allowing the organ to expand. However, when it loses this ability to stretch, pain may occur as the penis enters the vagina. This results in painful intercourse, known medically as dyspareunia. In some cases, the penis may not be able to enter the vagina at all. Sometimes only the glans enters, or the penis may only go in halfway. Yet when it does enter completely, the woman might experience severe pain in her groin, which can lead her to avoid sexual intercourse entirely. What other symptoms might occur? For instance, narrowing of the urinary tract can take place, making it difficult for a woman to urinate. Sometimes the distance between the anus and the vagina decreases significantly, causing pain in the vulvar area. However, the most common complaint is pain during intercourse. If a woman is not sexually active, she might not notice this narrowing. But if the tissue becomes excessively thinned, it can result in burning sensations during urination that lower her quality of life. Most often, though, women come in saying, "I can't have sex. It hurts too much during intercourse." So, what is the most common cause? I'm sorry, but the most common cause is cervical cancers. Following that, radiotherapy, that is, radiation treatments applied for therapeutic purposes, is used. Radiation therapy essentially wipes out the cervix, transforming that region into a structure as hard as concrete. The tissue becomes extremely thinned, becoming as delicate and permeable as muslin, or even as fragile as an eggshell or an onion membrane. Think of it this way. Our hands have robust tissue. When we hold something or lift a fork or knife, we have no difficulty. However, if there is a burn or wound on our hand, even the simplest touch can be painful, right? Similarly, the muscular structure of the vagina becomes thinned out. It turns into something as weak and permeable as muslin. So, what happens in this case? When we perform an examination, we observe small bleeding spots called petechiae. The blood vessels dilate and leakage occurs. Bleeding can also happen during intercourse. Ulcers may form on the labia, that is, the outer lips, and in the vulvar area. When a woman urinates, if her acidic urine comes into contact with these areas, she experiences severe burning sensations. She might even feel pain in the vulvar region when sitting down or standing up. The average length of the penis is between 13 to 18 centimeters, and its circumference is about 5 to 6 centimeters. We consider it normal if 2 fingers can comfortably enter the vagina. If the entire hand can fit, it is seen as an abundance. However, if not even one finger can enter, that indicates vaginal narrowing. What are some other reasons for vaginal narrowing? First and foremost, hormonal causes come into play, especially the rapid drop in estrogen. Entering menopause at an early age or undergoing surgical menopause, where the ovaries must be removed, are significant factors. Ovarian cancers can also contribute to this issue. Additionally, advanced stage adherent ovarian cysts may play a role. Particularly, endometriosis, often referred to as chocolate cysts, can lead to vaginal narrowing. Lastly, scarring that occurs after surgeries is another important cause. In addition, women who have experienced traffic accidents or have undergone frequent operations related to the vagina, bladder, or urinary tract may also incur tissue damage. During childbirth, large incisions may be made and extensive repairs might be required. Moreover, a hormonal deficiency, specifically insufficient estrogen, means the tissue is not adequately nourished, causing the vaginal tissue to become drier, more fragile, and more sensitive. Additionally, if sexual intercourse does not occur, the vagina can gradually narrow over time. This is because every muscle in our body loses strength if not used. For example, if we do not use our arms for a long period, our arm muscles weaken, thin out, and sag. Similarly, if we do not exercise our legs, the muscles relax, the tissues lose firmness, and we quickly become fatigued when moving. The same applies to the vagina. Its muscle structure weakens, and its function diminishes if not used. However, if one leads an active life, regardless of age, whether 60 or 70, if the person is constantly productive, lives close to nature, in touch with the earth and water, for instance, like a farmer or someone engaged in animal husbandry, then the muscles can remain stronger. In the past, women were generally more active, but nowadays increased inactivity has led to earlier aging of muscle structures in women. Especially during the menopausal period, if a woman is not sexually active with her partner, the complaints of narrowing and burning become even more pronounced, and often it is these issues that lead them to seek our help. Are there any other conditions that shorten the vagina? Yes, particularly hysterectomies. In some hysterectomy procedures, and sometimes to reduce the risk of cancer, a portion of the upper vagina is also removed along with the cervix. This can result in a shortening of about 2 to 3 centimeters. This situation can cause serious issues for women who undergo the surgery at a young age, in their 30s or 40s, because when the vagina is shortened, sexual intercourse can become painful and distressing. Sometimes other reasons arise later on. For instance, there is a term you have been hearing a lot lately: penile filler. We will also share a video link about this. What is a penile filler? Why is it performed? What side effects might it have? You can learn the answers to these questions in more detail in that video. Recently, concerns among men have also increased. In particular, some procedures are being carried out with expectations like, "I want a thicker penis, a larger glans." These concerns can emerge due to the images seen in the media, explicit content, or even conversations within men's chat groups. Especially among young men on the verge of marriage, there can be sudden decisions to undergo these procedures driven by the worry, "What if I can't make my wife happy?" Yes, if there is a genuine need and a valid medical reason, such procedures can be done, just like our labiaplasty or vaginoplasty surgeries. However, in a healthy man, procedures performed solely for the sake of having a larger penis can actually lead to sexual incompatibility. Even though the vagina is an elastic organ, it has its natural limits. For example, if a vagina that typically stretches to about 2 finger widths is forced to have a penis that is 4 fingers thick, or significantly thickened, inserted, it can cause pain. In other words, attempting to fully insert a thickened 25-centimeter penis instead of a normal 15-centimeter one can become a seriously painful experience for the woman. In such a case, the woman might not only lose the ability to reach orgasm, but could also begin to refuse intercourse due to the pain. That's why compatibility is so important. However, when we try to deviate from this natural harmony, especially when unnecessary interventions are made, we can unfortunately encounter very traumatic consequences. Particularly, the fillers used for penile thickening can create significant incompatibility within the vagina, and, unfortunately, the procedure cannot be easily reversed. Until these penile fillers dissolve, which can sometimes take up to a year and a half, the couple is forced to live with this incompatibility. That is why it is crucial to be extremely careful when making a decision. It is important to consult not only with a urologist, but also with a gynecologist. The structure of the vagina must be thoroughly evaluated before proceeding. For instance, while penile fillers may be traumatic when engaging with a newlywed, in the case of a woman who has had 3 births, with a naturally loose vagina and who prefers to avoid surgery, her partner opting for a penis filler, in other words, thickening his penis, can add more pleasure and compatibility to the couple's sexual life. That's why we always say, before undergoing any surgical procedure, it is essential to have a detailed discussion with a urologist and a gynecologist who specialize in sexual health. A surgery performed haphazardly can disrupt sexual harmony or even cause problems for both men and women. In contrast, procedures carried out with the right decisions can bring more happiness, heightened pleasure, and an overall improved quality of life for couples. The fact that the age at which cervical cancer occurs has dropped to as low as 17 is a cause for concern among us gynecologists. I regret to say that radiotherapy, that is, radiation treatment, can lead to serious tissue damage in the vagina. For this reason, we aim to help our patients go through this process with minimal harm by raising awareness about both vaginal tightening surgeries and vaginal care. However, this requires a multifaceted and meticulous consultation process. It is crucial that oncologists managing radiotherapy and chemotherapy, the team performing surgical interventions when necessary, and the obstetrician-gynecologist planning the patient's sexual life through subsequent hormonal treatment work together. Additionally, once the treatment process is complete, regular care and information programs must be implemented without interruption. Yes, we truly wish that no woman would ever have to face cancer, especially genital cancers. In fact, it's not just women. We hope that no human, no animal, no living being ever has to face cancer. But even if such a situation does occur, we want that couple's sexual life and quality of life to remain intact, not decline, not be lost in any way. We've prepared this video especially for women and couples who are dealing with vaginal narrowing and painful intercourse. I hope it's helpful for you. And if you share it with others you think might benefit from it, you'll be making a truly valuable contribution to both humanity and science. Thank you all very much. I wish you a life filled with health, happiness, and joy. Take care.